The development of ADCs, the antibody-drug conjugates, is completely reshaping the way we are thinking about combination therapies, in particular combination immunotherapies, because we had in the recent past conflicting data regarding chemoimmunotherapy combination trials, mainly in frontline metastatic setting. And besides this, we have accumulated strong data that have been presented at this meeting, pointing to the role of different associations of immunotherapy, in particular with the ADC. In particular, the combination of Enfortumab vedotin, which is an ADC targeting a targeted protein which is called the Nectin-4, and delivering a chemotherapy agent to the tumor cells, in combination with Pembrolizumab in frontline metastatic setting in patients who are ineligible to receive cisplatin chemotherapy, providing extraordinary and confirmed extraordinary data in terms of response rate in the further cohort of the EV103 study, which is a multi-platform study testing different combination therapies with Enfortumab vedotin, and in particular the cohort for whose data have been displayed in this meeting was a randomized cohort of patients to receive EV-Pembro combination or EV as monotherapy, and in particular the EV-Pembro combination provided extraordinary data in terms of objective response rate, while the EV monotherapy in substance confirmed the data in terms of activity of the drug as monotherapy. So the future is likely that we will change the way of thinking about combination therapies, and ADC immunotherapy combination is likely to become the newer way of thinking about combination therapy instead of using chemotherapy up front, of course pending the results of randomized studies that are ongoing today. These are emerging points related to the safety, because physicians and patients should be very well of the fact that by managing different agents like ADC, in combination with immunotherapy in particular, we may be able to manage the emerging side effects from combination therapies or from combination ADC and immunotherapy, like skin side effects, like neutropenia for other ADC, and other side effects that are not those typically managed by a physician when dealing with chemotherapy. So a strong body of knowledge should be accumulated regarding the safety management of these patients, and the educational pathway should be spent, educational efforts should be spent towards the education of physicians to work in collaboration with other specialists in trying to minimize the risk of having these patients stopping treatment due to toxicity.